important. And metrics and monitoring for evaluation systems should be instituted. There should be an incident management team within a public health command and control center. Vulnerable population mapping and consideration is important. WHO also had a COVID-19 partners platform that enables countries to work with international partners, donors, to coordinate and finance activities in real time. This also became more important once COVID-19 vaccinations came out. And then monitoring and implementation of this preparedness and response plan, production and of regular monitoring and situation analysis and report. And then you have to continuously send out advice and standard operating procedures to relevant stakeholders. The second pillar, which is extremely important, is communication and community engagement, also known as RCZE. Communities and interaction with them, taking them on board is integral in not only preventing and controlling the epidemic, but also as new treatments and vaccinations come on, and also to avoid misinformation and address myths. This part is critically important. You address the demand side barriers to health service utilization by RCCE, and you inform the community's measures to mitigate the socio-economic impact of the zoonotic disease and the pandemic, and the control interventions that the government is instituting. We have done some work in this regard. And here you can see a recent publication that we put out on the coronavirus pandemic in Nordic countries, health policy and economy trade-off. As you can, some of you might know, in the Nordic countries, in the Scandinavian Nordic region, Sweden had a very different response compared to its neighboring countries, where Sweden, had very relaxed health policy measures and open borders, and while the other neighboring countries of Denmark, Denmark, Finland, Iceland, and Norway had pretty stringent health policies in line with similar actions globally. And so what we basically did in this paper, in this study, was we looked at the health policy measures and the economies, macroeconomic indicators and health policy and epidemiology indicators of the Nordic and the Scandinavian region. And what we found out was that Sweden's economy did not do much better compared to the neighboring countries, in spite of Sweden having very relaxed health policy and epidemiology, measures. We are involved in doing similar, regional analysis of health policy and economy trade-off. And some of the findings that we have for developing countries is quite different from what we saw in the Scandinavian and the Nordic region. Continuing with the risk communication and community engagement, strategy. It's very critical to communicate with the public about the zoonotic diseases, and what do we know about it, how it is transmitted, and what precautions can be taken by the public to prevent its transmission. What are the actions that the government is taking to control the pandemic, and what are the public health response measures? And then lastly, what is the future course of action? All of these elements are critically important in the RCCE strategy, and timely, rapid behavior assessment is needed to be undertaken to understand, the changing trends, perceptions, concerns, and that the community might have with regards to, the zoonotic disease or transmission or prevention. Engagement with the communities can be done, through various channels, but it should be done via community-based civil society organizations, community leaders, and religious leaders and influencers, and the whole communication strategy should involve the community. And, it should be a participatory strategy involving the community. For example, with every aspect, preparing of local messages, pre-testing it in the community, and seeing how the message is consistent across the country, sometimes in different local languages, in different dialects, and so on and forth. uh, all of this leads to trust building and engagement of community. Again, becomes even more important with new therapeutics, vaccines, etc. Again, it's a two-way channels should be employed. There are various tools that can be undertaken to achieve this, such as a hotline. There should be a national health helpline, online platforms, interactive mobile applications, and so on and forth. Some of the community feedback that can be provided can be utilized to address concerns and dispel myths and misinformation. And then community engagement is vital for behavioral changes approaches to ensure a public health measures to prevent you know uh, the transmission of the virus itself. There are different ways there are different channels for the RC strategy through print, social, and electronic media, and all of these should be utilized. The next pillar that we're going to see is surveillance, epidemiological investigation, contact tracing, public health, and social measures. Some of the objectives of surveillance are as follows. The first one are the cornerstone of managing the spread of zoonotic diseases, which is to identify, isolate, and treat the actual cases. Then you go on to trace and quarantine the contacts that have been with the cases, and then monitoring of the COVID-19 transmission at an epidemiology level, with epidemiology trends and analysis. And then case-based reporting is undertaken and reported to WHO within 24 hours under international health regulations. Training of rapid response teams to conduct these activities. And then at a government level, you produce like epidemiological and social science reports on a weekly, monthly basis that are then used to adjust public health and social measures. Again, there should be a national strategy. For example, the test, trace, and quarantine strategy. The testing capacity for zoonotic diseases should be strengthened at all levels. And then under the test, trace, and quarantine strategy, for example, objectives would be to identify clusters and hotspots that would enable targeted lockdowns and need-driven resource optimization at all levels, starting from the federal to the provincial to the local level. And then, there's a wider strategy that is, instituted by the federal, provincial, state level governments. For example, for imposition of smart lockdowns during the COVID-19 pandemic, which was based on, tracking, tracing, and screening. And this was to avoid like complete lockdowns, which were utilized initially till testing capacity and public health capacity was strengthened. And then disease surveillance and response units have to be strengthened at all levels, and these should be undertaken in collaboration with the emergency operations centers at the provincial level. The next pillar that we are going to see are the points of entry for international travel and transport and mass gatherings. Points of entries are important to prevent importing of cases from the neighboring countries from international travel via airports, seaports. And these go together to support surveillance and risk communication strategies. So the first thing is there should be a national point of entry public health emergency plan under which point of entry staff are trained and equipped. There is surveillance and case management done at these POEs. There are capacities and procedures for not only screening the travelers or the visitors that are coming through these the airports, seaports, and land routes, but also there should be procedures to not only screen them, but for also international contact tracing that is done with, you know, um, by cooperating with countries around the globe. Uh, there should be rapid health assessment and isolation facilities at these POEs to manage patients that are ill and safely transport them to designated hospitals, healthcare facilities, etc. And then there should be a mechanism to communicate COVID-19 guidelines and the travelers that are coming through these port of entries. There are these risk mitigation measures at these points of entries. And again, there should be screening mechanisms for signs and symptoms of travelers, closure of borders when required. There should be standard operating procedures and national action plan at the airports for international flights. There should be targeted testing for COVID-19. It was thermal screening and active case finding. Quarantine for international travelers and then selective travel restrictions for some countries. Again, we've seen this in the previous slides as well, that SOPs and contingency plans should be in place. There should be trained rapid response teams with an ambulance that should be available at these points of entries around the clock to transport and move travelers that are suspected of having the zoonotic disease from the POE to designated hospitals and isolating them. Continuous training of human resource on screening, data collection, and data management needs to be done at these POEs. And a lot of countries have digitalized all of these mechanisms at the points of entries and created management information systems with mobile application apps and so on and forth that you need to fill out before traveling to the country. The next pillar that we're going to see are laboratories and diagnostics and capacity for testing for the zoonotic disease. Diagnostics and testing and increasing testing capacity is essential to not only prevent transmission, but also to have accurate epidemiology indicators and the burden of disease and the COVID-19 pandemic gave provided the countries with mechanisms to strengthen their labs, the subnational labs, the local labs at all levels. And then it's important to not only strengthen the testing capacity, but also have standard operating procedures for all activities and in the lab, from specimen collection, management, and transportation to actually reporting of results and etc. These also include identifying hazards and biosafety risk assessment, supply chain management for labs and diagnostics is critical. With molecular testing, access to reagents, kits, etc. is absolutely essential, and these should be ensured. And then, again, operational and logistic support for lab supplies should be sustained for COVID-19. We saw that rapid antigen detecting tests and kits for those were important, and reagents for PCR tests were really important as well. With decentralization of labs, it is important to link them within the national network of the labs and have the lab data reported upwards for epidemiological data management and timely reporting based on the testing results. At provincial level, local level, and national level, there should be surge plans in place to handle increased not only demand for testing, but also increased patient load for zoonotic diseases. And then, there should be monitoring and evaluation of diagnostics and testing mechanisms of how the tests compare to the gold standard throughout. And then, again, quality assurance mechanisms are important from point of care testing, including quality indicators, etc. It's important to have access to international reference labs. We saw this was very important in the COVID-19 pandemic, where there were different variants of the SARS-CoV-2 virus, and countries were encouraged to increase sequencing of the virus of the SARS-CoV-2 virus and report the SARS-CoV-2 virus genetic sequence, so that emergence of new variants could be shared globally. And then there are mechanisms at the WHO level with the Global Influenza Surveillance and Response System, GISRS, which comprises of a network of influenza centers and labs in the 124 WHO member states. There are national influenza centers, WHO collaborating centers, WHO H5 reference labs, and essential aggregated labs. There are also genomic surveillance regional networks, and WHO is in process to create a secure repository for storing and comparing viral genetic sequencing data globally. The next pillar, I think this is the seventh or the eighth pillar, is infection prevention and control and protection of the health workforce. This is critical. Infection prevention and control measures are important at both levels, at the level of health facilities and at the level of community, to not only prevent transmission, but also to protect the frontline health workers, which we've seen in the recent pandemic, were had many issues with shortage of PPEs and equipment, and it only added to the exhaustion of and the burden of the frontline healthcare workers. So there should be IPC measures at all levels of healthcare system, with trained staff and sufficient IPC materials, with personal protective equipment, PPEs, and water sanitation and hygiene, services and stations, and so on and forth. And these should be assessed at all levels, not only in hospitals, but also in public places. And then, national IPC guidelines should be not only reviewed and updated, but also passed down to the provincial and local level. And there should be national plans in place for supply chain and logistics for PPE supply, and to identify any shortages in PPEs or wash services, etc. There's a fair amount of reporting, and investigation of all cases of healthcare associated infections to prevent transmission of zoonotic diseases in hospitals and the health system. And then IPC guidance is not only important at the healthcare level, but it is also important in other facilities for long-term healthcare, hospice, nursing homes, community care providers, etc. And these should be implemented at all levels, including triage, early detection, infectious source controls. There should be visual alerts, educational material in the local language, etc. The next pillar is case management, clinical operation, and therapeutics. It's really important to have designated health systems, an idea of ICU capacity that goes hand in hand with monitoring the burden and the health system capacity, which we've seen in the recent pandemic. Again, this also goes with the RCC strategy with the community, to inform the patients on when when it is important to go to the hospital if the health system is burdened, and if there are mild symptoms, they should not seek to be hospitalized, but get the tests done, and then stay at home in quarantine. COVID-19 specific protocols should be passed on to the healthcare systems. There should be triage and screening areas at all levels of healthcare facilities. And there should be sufficient equipped teams, ambulances to transport suspected and confirmed cases, and referral mechanisms, designated hospitals to care for um, patients with zoonotic diseases. This is a recent publication that we carried out in which we used a machine learning model, a novel deep neural network model, to predict mortality in hospitalized COVID-19 patients. And what we did in this study was we took variables in the first 24 hours of admissions and fed these variables into this deep neural network model to predict inpatient mortality during the course of hospitalization. Um, we also created a web app uh, and put a calculator out there in which you could enter the variables in the first 24 hours of admissions, and it would give a predictive mortality percentage for the patient. We did this pretty early on in the pandemic, and this work created a lot of interest globally, and there were it became really important when ICU capacity and emergency beds and hospital beds were at full capacity to have such a model to predict mortality, to be able to triage patients, etc. Moving on further with case management, there should be quarantine facilities. Dedicated quarantine places should be ensured at all levels with properly trained support staff and medical support. There should be policy formulations for citizens who are stuck abroad and are traveling back. And then, there should be strict implementations of all standard operating procedures, including state monitored quarantine period and in designated quarantine centers, or paid hotel facility if travelers don't want to go to these government quarantine centers. There should be designated hospitals with isolation wards that should be established for COVID-19 patients in public and private health system and hospitals. There should be emergency response teams that should be able to, identify and transport COVID-19 patients in ambulances to these designated hospitals. The case definitions should be uniform, and WHO standard case definitions should be used to identify patients with zoonotic diseases. The total number of beds allocated for the management of COVID-19 cases should be monitored and expanded. The same is the case for ICU beds with ventilators. This, I think, is is one of the last pillars for operational support in logistics and supply chains. We saw in the recent COVID-19 pandemic that there were huge operational logistics and supply chain issues internationally, with shortages of essential supplies, testing reagents, PPEs, medications, etc. So all of these should be, should be ensured at a national level. Resources should be mapped out, and supply systems and in-country inventory review should be done on a regular basis. There should be a central stock reserve for all of the essential items, medications, equipment for managing, the next pandemic. The supply chain control and management system should be in place. Procurement processes should be reviewed, and the having gone through the pandemic has strengthened the operational support and logistics systems at multiple levels. So when the next pandemic comes around, countries would be better prepared. Again, we've discussed this, that capacity should be strengthened to meet supply chain needs, including for PPEs, but there was a shortage of oxygen cylinders and in many developing countries. The capacity of local market to meet these shortages has now increased. International coordination and request of supplies through regional and global procurement mechanisms are in place. Surge capacity, measures should be in place with preparing staff and deployment mechanisms. for COVID-19 vaccines, cold chain support and storage should be ensured. And this was really important. Maintaining essential health services and healthcare delivery during a pandemic is critical, because most of the resources, most of the health system staff, and supplies and equipment are utilized for handling the pandemic surge. And so the essential health services suffer as a result. So there should be a mechanism in place that essential health services continue, and there is no disruption in these services due to resources being allocated to handle the COVID-19 surge. Again, misinformation is another important reason that leads to changes in health seeking behavior and reduced demand for health services by the population. And so the RCCE strategy is very important to tackle misinformation and myths, etc. And there's also this opportunity to invest in long-term plans, for example, for increasing public health functions, primary health systems governance, and health information systems, etc. This is the last pillar for vaccination. As we saw, in the COVID-19 pandemic, that vaccines were not available initially, but then once they did become available, their availability, accessibility, and deployment and scale became the highest priority. And there were lots of bottlenecks reasons for vaccines not being able to reach the people, from their uh, you know um, from the procurement to cold chain and issues, to misinformation about the population not having vaccination hesitancy. So all of those should be tackled. WHO has worked through the COVAX facility with the ACT accelerator to coordinate and accelerate the availability of vaccines globally. And then there is this WHO's partner platform, which is operational for all the countries to upload their national vaccine deployment plan. And this was one
Go.
recent work
2
that
minutes.
we did, that looked at COVID-19 vaccine hesitancy among refugees and non-refugees in Kenya. And I will end right there. Thank you.
Perfect. Sorry.
Is it Q&A now?
Yeah, there's now we have a Q&A, but there's only one question so far. People can still write down your questions here. I will read the question. What is One Health focus on? Environment health, and if there is any challenge on collaboration with other focuses, such as public health and animal health, both domestic and wild. So it's
So One Health really is an intersection of environment health, animal health, and human health. All of these three combine to together complete One Health. And so the focus on environment health is huge. You know, uh, a lot of zoonotic diseases that are now emerging and have and are becoming epidemics, like dengue fever, for example, is due to urbanization and deforestation, where the Aedes aegypti mosquito has been moved and replaced other species of mosquitoes to live in urban centers, where it causes dengue, and the same is case for malaria. So a lot of the diseases that have become epidemics, a lot of these zoonotic diseases are due to changes in the environment and urbanization. So environment health is a very important contributing factor for zoonotic diseases. And similarly, the same goes for animal health, like we saw, with COVID-19, with zoonotic diseases jumping from animals to humans, and so on and forth. So the emphasis is huge. One Health is the approach to collectively, uh, take a holistic approach and holistic measures to combat all of these, hopefully to prevent the next pandemic. So the today's talk and the lessons that we've learned from the COVID-19 pandemic is how do we prevent the next pandemic? And that is why this program is so essential. Uh, and programs like these will become more and more important to develop these global networks between researchers, public health officials, One Health people, environment health researchers, animal health researchers, uh, to be able to communicate and work together.
Thank you. Furquan, next question. There's a great deal of work to do and resources can be scarce. How should we think about prioritization and sequencing of projects to meet these needs progressively?
I think I think that's a good question, and we have been doing quite a lot of work in fact, one of the papers that I showed about the situation analysis in Pakistan was one of them. Um, the thing is that some of the most important things is is uh, is not really dealing with the next pandemic, but how do we try and prevent the next pandemic? I think that is critical, and we have seen here in the U.S. As well as globally that you know mechanisms for public health, animal health, environment health are absolutely critical, and resources are really being prioritized on how do we control vectors for zoonotic diseases, how do we a great deal of investment is going into research on genetic sequencing of these viruses, SARS-CoV-2 and others. So I think it's not a very simple question to really answer how to prioritize these, but I think the priority now has shifted from managing epidemics and pandemics to preventing pandemics, and I think that's where the priority lies at all levels: environment health, animal health, and human health.
Thank you again. We don't have other questions, but we have some comments. Mr. Chang says, but environment health is also including health hazards, including climate changes, as mentioned by Dr. Irfan, those impact on wildlife, drought, infectious diseases, transmissions, and food security, etc. It's really, really broad range of issues. I don't have any questions here. And Dr. Irfan, we do plan to share the slides.
Sure.
Okay, that's great. We will follow up. Is that? And now, Ramji, do you want to introduce our country leaders and
yeah, sure. Ching, thank you so much for moderating this, and thank you, Furkan, for your excellent presentations. And this, COVID case we presented here, in fact, I know this gives a lessons that we can leverage to other, the future pandemic and future cases as well. I think this is an excellent example. And a couple of things I would like to mention in here is one of the objectives of this project is, establishing a research fund that will be providing to the country, Mekong country researcher, select researcher. So there is an opportunity, big deal of opportunity that country researchers can compete and also and utilize those research funds to research in the area of their needs. So said, we are working with Mekong three country leaders. In fact, University One Health coordinator, of Laos, PDR, Thailand, and Vietnam. And we really thank you for your support and collaboration. And Sangden, Dr. Sangden, Dr. Fook, and Wanapon. I don't see Wanapon in here, but we could see Sangden and Dr. Fook in here. So they serve as the coordinator for their respective country university, One Health University Network. First of all, I'd like to request Professor Sangden for your remarks in a couple of minutes, about these presentations or overall. Please, mic is yours.
Yeah, thank you very much, Professor Ramji. So first of all, so my name is Sang Duan, right? So I'm from Faculty of Tropical Medicine, Mahidol University, and I also serve as the coordinator of Thailand One Health University Network, right? First of all, we would like to thank, right, Michigan State University that launched this project, and at one of the beneficiaries, right? So who gonna get the like the people gonna get like what you call in terms of health literacy, like how to manage the disease in the regions, right? And also we also heard about the research or the collaborative network that gonna build in the next 3 years, right? And how to foster, right? This, how to prevent or how to do the better surveillance of the infectious disease in Thailand, Laos, Vietnam, and also other part of the world using the One Health approach, right? And from Dr. Ramji, he also provide the in terms of the what you call the overview, what we expect to see, what we would like to get in the next 5 years, right? And we would like to thank also Professor Alphonse, right? He give us the a kick-off like a lecture on the surveillance or the pillar, 3 pillar, right? I think that on the zoonotic disease surveillance, right? The first one, he talks about the disease, right? Give the example of COVID-19, right? How we detect, how we surveillance those, how we diagnose those properly effectively, right? And for this one, I think that for my point of views, right? I think that the 3 pillar, like a surveillance diagnosis, and another is the case management, as well as how to manage the logistic thing, right? It's not easy when someone asks about how we prioritize that. I give the example when we after this, the COVID-19 gonna be more relaxed, right? The case gonna be fat down, right? Flatten down. And when we don't have many of the case, right? So the priority of each country gonna be different, right? The money and the resource gonna be mobilized to other things, right? And how we could ensure that we're gonna have enough resource or the system that already prepared, right? When we have the next wave, no one know about when it's gonna happen, right? So how we prepare for that when we have another priority or limited resource, right? I think that it needs to bring the several discipline and sector, right, to have the regular meeting and to plan, to oversee and assess those, right? And those are the things that I think that we learned from Professor Irfan today. And I think that there are several areas and opportunity for us, right, to work together to fulfill, to foster the thing that gonna be the gap, gonna be the gap or the challenge in these 3 pillars of the zoonotic disease surveillance, right? Okay, thank you very much.
Thank you so much, Professor Sangden, for your reflection of the presentations and today's discussion. Dr. Phu from Vietnam, he's the One Health University coordinator from Vietnam. Excuse me. Please, mic is yours. You may wrap up. Your comment in a couple of minutes.
Sorry, yeah, thank you very much, Ramzi and Professor Fukan for presentation. So I think it's that are very on time. We are discussed about the One Health as a movement. So it's a long time ago, in maybe more than 10 years, we're talking about One Health. Even for me, it somehow confused how we can work with a different field together. So after 10 years now, we see it very clear and a lot of opportunity for us to discuss and exchange and to more close linkage with each other. So after mentioned that it, or even one question raising here about the environmental sector is still not involved in the One Health concept. I think that it's very, very important now. After COVID-19 pandemic, to make the people at a different level, different area, they change the mindset and the rethinking about how to protect the ecosystem, including the environmental. So I see that very clear about that. And the second thing that is environmental pollution, including the water pollution, wastewater, or the air pollution. It's a lot of things linked with climate change and our environmental. So after COVID-19, a lot issue about the waste from the health facility discharged without treatment or the improperly treatment. So maybe kind of transmission, some pathogen to everywhere. We don't know yet. So now we need to IT or AI techniques to need to really to early detection to identify where has the hazards and how we can mitigation and expose this animal, people, on the environment. So for Vietnam, up to now, we are very luckily we get very high support from government to establish a One Health partnership platform. Seen it 10 years ago, it now ongoing for next 5 years. So they focus, they get 7, 8 focus area, including environmental, wildlife, it's antibiotic resistant, food safety, and of course, the zoonotic disease. And other part, it linked how we are linked to NCD. It's a non-communicable disease, like hypertension or diabetes. So that all the people linked to the food value chain. So it means that if we are bringing all into one, but at a very early stage, it could be better. The last thing that I see very important, the role of the future leader on One Health. So it means that the university is a center, so it can generate the true with a One Health leader. They had enough capacity, knowledge, experience, and working together. So it means that I see that our network, both in Southeast Asia, in Africa, also in US partner. So we need really to work together and more. It's an event like this to exchange a lot of experience and bring student lecture and expertise, both side, South-South collaboration and North-South collaboration. So I see that it could be useful for us. And the lastly, I would like to bring that learning and apply the One Health in easy way and apply through the research activity. Or we develop some very specific case study. So case study to make the people have good chance to practice in the One Health together in the same area, in the same field. So thank you very much to bring our network to join this project. And we hope that Mohit will become to succeed and we can expect to expand the network in the future. So thank you very much.
Thank you, Dr. Pham. We are really on time. Good job, everybody. Thank you for this successful kickoff events. 2 things, we're going to follow up with PowerPoints with everyone. And also after this seminar today, you will receive an email and a link of Qualtrics survey regarding today's webinar. And also we want to hear from you, your input and advice for future webinars and topics you're interested in and what questions you remain. Please don't hesitate to contact us. My email is on the flyer of today's event, but we are also setting up a specific email for the Mekong project. Will be a mohip, it's called at msu.edu, but we need to get waiting for the final approval from the university. Thank you again. We will stay in touch and you will hear from us, and we hope to hear from you as well. Have a great day and have a great evening. Thank you again.
Thank you, everybody.
Yeah. Bye-bye.
Bye-bye.
Take care.
Bye.